welcome everyone who's joining us from, as I understand, all parts of the country today. So hopefully everyone's having a good Friday and looking forward to the weekend. And I appreciate you spending time with me today. Talk a little bit about some of the compliance, regulatory, and business risks facing your healthcare organization. My name is Scott Sissel. I'm the partner in charge of the health system subsegment of Eide Bailey's healthcare industry practice. I also have some roles around internal audit and compliance as well. And certainly from a healthcare perspective, the last, I guess, almost 6 months now have been a very exciting and challenging time for many of you that are working in the healthcare world. Today, we're going to spend a little bit of time talking about some of the key or emerging risk areas that are out there. And by way, maybe a little bit of background, I do understand that people that are calling in today come from a variety of aspects of the healthcare world. So the risk can certainly vary by type and the nature of the organization. Some may be more or less significant to you depending on the type of organization that you're with. So kind of just a bit of a disclaimer there as I go through it. I'm going to try and certainly talk about some of the more significant things that are out there. Topics today, there's certainly quite a few things here that are on the list. Talk a little bit about the current state of the industry and then really touch on several other areas. In 50 minutes, we certainly can't take too much of a deep dive on any of these. And also, I understand that many of you probably have dialed into other webinars that we held on certain topics, as this is the fourth in a series of webinars we've held around certain risk areas. We've talked already about reimbursement and related risks, tax compliance, and then some things around revenue cycle as well, the regulatory landscape. So while I have a few slides on it, I do tend to, will most likely go through those fairly quickly. I've got a fair amount of slides in the presentation today as well, and some of those are just really for your information. So certainly if you get questions, feel free to ask, and we'll address some of those really at the end. But also some of this will be a nice leave behind for you as well as you go back to your offices and your business places. A couple things just talking about the state of the industry. Certainly the dramatic changes that have occurred have really made people think a little bit differently about their business and their operations, their risks, and those sort of things facing the organization. We've heard the term rapid risk assessment occurring, and we've also seen that in the budgeting and forecasting area where organizations really had to move pretty quickly to take a look at their business and their operations and make some changes very quickly. Certainly with the impact of COVID pandemic, operationally things had to be adjusted extremely quickly and in short order to adjust their own facilities to handle potential infections, access PHE and other supplies, and look at staffing and other staffing arrangements. In addition, you know, I term it crisis management. In some cases, back particularly in the fall, there was some significant activity around what I call crisis management and financial management. What does cash flow look like? Where are we from an investment perspective? Have we looked at our lines of credit? Can we access additional lines of credit in the event cash became a significant issue due to, at that time, shutdown of some elective procedures, potential cost increases, potential need to access other resources. In addition, the delivery of care certainly changed very quickly as well, particularly around the area of telehealth and how those services were, how healthcare was being provided. These are things that have been discussed for quite some time, but given the COVID pandemic, these changes happened really quickly. In addition, I think a lot of organizations have taken a step back and taken a look at all their service lines and maybe better understood where they were from a service line perspective, from a profitability perspective, from the ability to staff and manage those areas, and are probably taking a little bit harder look on what, particularly in the health system space, what areas they're going to focus on and maybe what areas they're not going to focus on. Clearly, all these things had a fairly substantial impact on organizations. And really many of you calling in probably were on the front lines of revising what you had been doing, performing additional assessments or new assessments, whether it be risk or financial analyses. I do understand many of you come from a finance standpoint, so certainly from that perspective, you were involved in those sort of things. Changing the way we do business. I think this is something that is continuing to be discussed, and I think in many sectors of healthcare, people are looking at this a lot harder as to what does this mean with respect to care delivery, and what does it mean to from the perspective of facilities and what type of facilities we do need. We certainly see out there in the marketplace people stepping back and looking at some of their capital planning processes and rethinking what's needed on a longer term basis, trying to understand better whether what's happening now will be an ongoing trend, or if it's a bit of a blip with respect to the use of more digital type telehealth type services. I think, you know, most people that I talk to think that this will continue. There maybe will be somewhat of a scale back to more in-person delivery of care, but I think most people think that given how people have become more comfortable receiving services and care in a different fashion, that will continue. In addition, we've seen things like rapidly changing processes and controls. Organizations had to react quickly to a remote workforce and ensuring their controls were in place, but also ensuring that the processes were in place to be able to still deliver the type of services you're performing, whether it be internal, whether it be financial related, accounting, compliance, legal, but also doing those type of things so that the controls continue to remain in place. The you know, the other item I'd point out is you know, with respect to capital planning, I think people have stepped back and relooked at their capital plans, as I mentioned earlier, and tried to understand what's critical, and really doing some assessment planning around probability of needs on a short and long-term basis. In addition, you know, one of the certainly good things that have happened, I think, to a lot of healthcare organizations, the CARES Act and some of the funding that was provided through provider relief funding and the advanced payment program. I will point out, though, it is important, and of course there's other programs as well. We have a webinar on September 29th that's going to dive deep into provider relief funding, and so that will go deeper than what I'll go here relative to provider relief funding. But a couple thoughts and couple things to make sure to keep in mind. Provider relief funding is subject at this time to single audit testing, and as a result of that, it's important for all organizations, and due to the compliance requirements around both PPP and provider relief funding, that you have appropriate controls and monitoring processes in place to make sure that you are complying with the standards and the requirements of these. It is fairly significant. I think the challenges, the rules tend to move, although more recently I think some of the movement in some of the rules and regulations have slowed a bit. There still is going to be requirements for single audit, and those compliance requirements will be coming out. We expect those to come out towards the end of September and October. So something to keep in mind as you look at those dollars. Many of the health systems I work with have received pretty substantial money with respect to this, and so it's a fairly significant item for them to monitor and manage, and certainly been helpful during these more challenging times. The other thing that we've seen from a risk standpoint changing a little bit is the whole supply chain, and certainly that's become really much more in the public eye, particularly as it relates to PHE that's needed. I think a lot of organizations looked at purchasing from a cost perspective and certainly a quality perspective, certainly trying to manage that in a way to have access to what the supplies you need, but certainly keeping an eye on cost. And oftentimes they narrow their supply network. And I think what's happened now is organizations are rethinking that to ensure that they have accessibility to various vendors, and that certainly has put a lot of pressure on the cost side of things. But given the experience of this, I think that's probably going to be a new way of thinking of risk around the supply chain area as well. Other issues that have been out there, and we'll touch on these a little bit through this session. Infections, as we talked about, cybersecurity, telemedicine, certainly incidents of violence in the workplace, and also probably stress in the workplace, given the risk of infection, and certainly some care providers in your organizations having to work significant amounts of time and additional shifts given what may be happening in your particular community. Opioid epidemic has been significant, and of course, customer loyalty and care delivery has continued to be a significant focus for a lot of organizations, and how best to really in this day and age, and particularly with the ability for customers, patients to use telehealth, does that limit or reduce the amount of, if you will, brand loyalty to a particular health system, since they're able to access care on their phone in some cases. So those are all things that are out there as far as a risk profile goes. And again, some of these we'll talk about a little bit about as we get into it. The first session I'm going to talk about is information security, and why should you be worried about it? I think this question, I think most of you probably realize in this environment, and really over the last several years, healthcare data breaches have continued to grow. I've got some statistics here. I think the point on this slide is that over the course of a couple-year period, this goes through September 2019, data breaches, the number of patient information impacted has more than doubled, and the number of breaches have increased pretty significantly, and I'm comparing a 2-year period to slightly less than a 2-year period. So the activity has grown significantly over the last few years. And why is that happening? Well, the fact of the matter is, one study that I looked at, health information out on the dark web is oftentimes much more valuable than actually financial data. Interestingly enough, the cost of a corporate data breach is over $3 million per breach. So, and I think maybe going back 4, 5, 6 years ago, when there was a breach, it became one of those really significant public relations issues. Still is, but I think the world has understood that there's a lot more of this happening, and a lot of management of it becomes mitigating the issue and managing the response to potential data breaches. Again, the other thing to keep in mind is a lot of you have moved to a cloud-based system, particularly for patient accounting or patient records. Cloud is just another service, so all that can be accessed. And there's probably additional risk relative to keeping information out in a cloud environment. Why do healthcare organizations have challenges in this area? Increased reliance on technology, not only in some of the administrative functions, but to deliver care, and how a lot of the medical equipment operates from a technology standpoint really increases the risk as compared to other industries. Remote IT workforce is kind of a new and growing item out there. Oftentimes in healthcare, we see that there's a heavy reliance on third-party vendor for certain components of IT services, or quite frankly, other services, medical care type services. Well, the fourth bullet point here, I think, has certainly been changing. I think we see this maybe across all industries. Top leadership probably has limited experience in managing IT risk. And I'm not saying within the IT department, but I'm saying oftentimes many of our C-level people have grown up in a world where IT wasn't as significant of an issue. And so it's become a much bigger issue more recently. And a lot of them just don't have the experience, and the boards don't either, from the standpoint of really understanding at a more detailed level the type of risks that are out there. I think funding and investment for cybersecurity has historically been something we've seen as an issue, although I do sense that's changing. And then, of course, the ability to access people and the experienced IT professionals or security professionals is an ongoing problem really across many industries. What's at risk? I won't read the slide to you. I think the thing I'd point out is it's really important as you're doing your risk assessment to understand where are the entry points, who has access, are we reviewing the access, including internal and external cloud computing environments, vendors, etc. Make sure to think about medical devices, where personal information may be stored. And finally, the other thing is network integrity and capacity. I think with more individuals working remotely and the advent of telehealth, I think that's one of the real challenges healthcare organizations have been faced with is do they have the network capacity to handle the larger volumes of activity that's occurring. One of the interesting things I saw was a Moody's report in September 2019 actually did raise concerns about the healthcare industry's ability to manage cybersecurity risks, particularly at smaller hospitals. So it's certainly on the rating agency's mind with respect to what you're doing from a cybersecurity perspective. A couple thoughts I'd like to leave you with in this area, and this is probably more from a management control perspective and risk. I think we really think cybersecurity should be a regular topic at the executive level and maybe even at the board level. It's not unusual for board meetings to include a variety of topics around financial, legal, compliance. This is probably one of those areas that maybe, historically we've seen maybe get some attention at a meeting a year. We do see that moving to this being a much more regular topic because of the risk to the organization. And certainly, given the pandemic, that's certainly something that's kind of raised its level of attention in organizations as well. It's important to know that cybersecurity is really part of the culture. Training, testing, it's everyone's responsibility, not just the IT department. All of us need to have an understanding of risks and how we can better manage those. Just a few thoughts on the regulatory landscape and billing and coding. We had a webinar just recently on this, so again, a lot of this was covered in more detail, and we'll certainly be having more kind of deeper dives in this area. A couple points to make. First of all, just a little background on the OIG. It's HHS's largest office in the federal government with more than 1,700 employees, and it's dedicated to combating fraud, waste, and abuse. We've continued to see a lot of activity by the OIG with respect to compliance and oversight of healthcare providers, and we expect that to continue. Right now, what we've seen is probably a better understanding of the challenges healthcare providers are facing. But we also realize that the pendulum tends to swing, and at some point in time, enforcement and monitoring will continue to be there and may even grow down the road. So couple comments. Many of you are probably familiar with the OIG work plan. It used to be an annual plan. Now it comes out on a routine basis, which creates a challenge for any of you that are in the compliance area of your organization, because you're required to really continually monitor what's in the work plan, and it does tend to be a nice roadmap for organizations to understand things that maybe or should be on your own internal monitoring process. Plan highlights. Again, I won't read a lot of these. I think the major thing here is takeaway is to keep this list in front of you. Some of the more recent updates relate to telehealth, and it's also important to note that this continually gets monitored, or continually getting modified and updated, and with new rules and regulations out there, and it's created, certainly a real challenge. And some of those rules are continuing to change and be updated. So to the extent you have some connection or oversight over billing, coding, revenue cycle area, I think it's very important to keep these close to you and make sure that things such as telehealth are a focus. As you can see, the first few items are telehealth related, and then some other areas COVID-19 related, including opioid treatment program challenges and those sort of things. So Again, keep that in mind. One thing I did identify was that a recent OIG case identified 96% of telehealth claims had incorrect documentations within them. So certainly something that's very important with respect to things happening from a billing and coding perspective. Compliance program. Couple thoughts here. This is really a slide that talks about some of the requirements relative to compliance programs. And I think the takeaways here is ensuring you've got policies and procedures, and those policies and procedures are up to date. Ensuring that you've got a compliance officer in place. You've got some sort of annual audit plan and monitoring, and that you've documented what you've done and you get support for it, so that if it is reviewed, you can support what you've done. It's also important to make sure you've got organization engagement, meaning that people within your organization understand the importance of a compliance program and are supportive and responsive to what's happening from a compliance perspective. Then finally, it is important to also have an education plan in place for your organization to ensure the various rules and regulations are made aware of within the organization, and new issues and risks are also being raised. We realize with smaller facilities that can be a real challenge putting this in place, but there really isn't a way to right size versus small versus large organizations. I think the risks may be different. The risks may be at different levels in a small organization than a large organization, but it is important to have these essential elements within your compliance program. Compliance hotspots. I think we talked about some of these already. A lot of these these points on this slide are what we call mid-cycle of the revenue cycle. So again, this is a bit more revenue cycle focused. There's obviously other areas of compliance that are important as well, but if you focus on the revenue cycle, here are some things that I think are critical, and I think you should ask yourself a few questions around these items. How confident are you with your organization's ability to be successful in the areas above? How engaged are your clinicians in understanding the charge capture process, and are the clinical areas accountable if there is rework? We see that as a real operational challenge, the amount of rebilling, recoding that's done due to errors on the front end. How robust is your CDI program, and have you implemented outpatient CDI programs? You have consistent coding and billing reviews done to assess some of the more higher risk or OIG work plan items. When was the last time you've had a charge master review? Has a new EMR system been put in place or upgraded since the last CDM review, and is this time for you to take a look at it? Then finally, who has ability to assign modifiers in the organization? That often, the lack of education or oversight and review is oftentimes one of the biggest errors, or biggest areas where we see lack of consistency and errors within these areas. Obviously, a lot of things here, and to keep in mind, but these are kind of the areas that we see as being higher risk and more prone to error. Just a few slides on some billing nuances that are out there. Again, I probably won't read through all of these. I will point out that the updates on telehealth continue to occur and have been occurring over the last several months. There has also been a section added around teaching physicians and residents and expansion of codes that can be billed as well. So again, just some points here around some of the coding. CPT, HCPCS coding will be dependent on place of service, freestanding, provider-based, or rural health. Ensuring you have some focus on the type of claim, and the coding can be different depending on where the service takes place. So just a couple things there for people to keep in mind and as a takeaway. Supply chain and operational considerations. I did make a few comments earlier about this. I think historically, a lot of the internal monitoring functions probably have been focused on financial reporting and cost containment. And so certainly those shouldn't go away, but I do think now, to the extent any of you are in the monitoring, financial reporting, or internal audit side, I think there's probably a need to really look at the overall process of vendor management. How do you assess vendors from the standpoint of not only quality and cost, but their ability to meet your demand? And from an organizational standpoint, have they assessed critical supplies and prioritize those that are more critical depending on the nature of the types of services the organization performs and the focus area? And is there backup, and what do those backups look like? And are contracts in place with vendors in the event there is significant need? Again, I think the pandemic has kind of raised those issues. Who are the critical vendors, and do you have the ability to access those supplies if needed? And again, those would probably have been a bit more on the back burner over the years. I will say, from a pure operational standpoint, I won't talk a lot about data analytics. This is probably an area that's more ripe for opportunity to use data analytics, not only looking at quantity verification and understanding usage rates as compared to inventory levels and billing, kind of tying all those together, but also really kind of understanding things like supply and timing of being able to access supplies. I've listed a bunch of things here that data analytics could be helpful in the supply chain area, but I think you could build out some really neat data analytic and business intelligence around the supply area, not only to address quantity, obsolescence, but also cost and efficiency, and even looking into potential fraud, particularly as you look at some of the crisis we faced around opioid. Human resource and cultural considerations. Just maybe a few things around that. This has certainly has always gotten a lot of attention in healthcare world because of the challenges in accessing resources as needed. And I think during a time where the economy was stronger, accessing those resources was probably a bit more of a challenge. I think from an HR standpoint, that's still true, but there's probably other issues that have increased recently. Things such as customer service in this environment become very important. Things such as cyber awareness have become very important. Certainly, health, ethical culture within your organization is important as well. But there's other human resource areas in addition. Has your organization done a good job of really assessing the pulse of your employees? I mean, this is obviously extremely stressful time for all employees, really, but certainly those that work in healthcare. When you're on the front lines of dealing with people with infections, the stress level certainly intensifies, and we've certainly seen stories of certain people having to work, significant hours during this time. So those are things to really keep in mind, and there's certainly some assessments and monitoring that your organization should be doing with respect to this. Consumerism is still a very significant component of healthcare, even more so, I think, now in this time, because the ability to connect with your customers, your patients, is probably more of a challenge. If they're not coming in quite as often as they used to. Trying to make sure you stay connected with them and giving them a good experience is important. Human resource issues, working remotely. I mean, I think all organizations have been dealing with, to the extent you have individuals working remotely, are they connected? Are they feeling connected to the organization? Do they feel there's a good team environment? And that obviously takes some additional work from that perspective. And again, I do think there's opportunities to do assessments around those and understand the pulse of the workforce. I mentioned some things about potential turnover and the stress they're facing. I think the other thing that we've seen recently is, I call it an HR audit, but not only auditing things such as what I mentioned, cultural aspects of the organization, getting an employee pulse as to their overall view of the organization, but also looking at policies and procedures with respect to staffing, with respect to hiring and retention. Certainly the country is going through a period of social unrest, and I think a lot of organizations are really taking a hard look at their policies and procedures for hiring, retention, etc., and in making sure that there's no bias within what they're doing in that area. And those type of things are very are a real opportunity to do HR reviews or audits, as I've called them. Couple thoughts on specialty revenue. These are maybe just some things that we've seen. I think a lot of organizations, they look at risk and potential problems with respect to managing areas, billing, coding, managing HR functions, compliance risks, those sort of things. There's probably a focus on their main operations, maybe their main hospital operations. Over to the right, I've listed just a few areas that can be problematic, only because, or partly because, they may not be part of the core activities or operations of your health system. For instance, pharmacy may be managed separately, maybe on separate financial systems, home health, on down the line. If you get psychiatry or dental operations, oftentimes we see those being those activities that are maybe outside the core control structure of your organization. And really the issue is, do you know what you don't know? Is there enough oversight to understand that everything seems to be working appropriately? We've also seen that compliance issues arise out of these areas as well for the same reason. They're not maybe because they're smaller from the standpoint of the size of these operations to the total organization. They don't get a lot of attention until a compliance review is done by the government, and then issues pop up. So I think it's important to keep an eye on those, or make sure you at least consider those periodically as you're looking at risk within your organization. The other area is incentive and risk arrangements. Again, I listed out several different things that are out there. I think one of the things we've run into is sometimes we see that organizations maybe are monitoring these from a perspective of not having all the data. Sometimes the data is provided by the insurance company or others. The data isn't as ripe for review or embedded within their control processes. And as a result, certain settlements or resolution of incentive arrangements are completed without maybe all the information needed. Again, it comes down to, I think, the organization looking at how significant they are. Each of these are from a cost and quality and pricing perspective, and understanding which ones may be more important to spend a little more time monitoring and managing. And that includes joint venture arrangements where you maybe have an investment in some organization, but oftentimes all you get is a quarterly financial without a lot more detail. You obviously are taking on financial and other risks with some of these, and so it's important to make sure you're comfortable with the level of information you're getting. And most of the time, these joint venture arrangements or other arrangements do have the ability for you to audit, monitor, or get the information you need. So just some things to think about there. Talk a little bit about pharmacy and related risks, and I won't go into a lot of detail on this section either. I talked a little bit about pharmacy and management and inventory management. Certainly there's a greater risk because of the need to access appropriate supplies, and also the risk of theft in certain areas, given the nature of the pharmaceuticals. The other thing I'm going to spend a little bit of time on is 340B drug discount program. Many of you have used or are taking advantage of this program, which was really set up And the intent of it was to allow covered entities to stretch scarce federal resources as far as possible. And really it was meant to lower some of the medication costs for patients, particularly those that were financially challenged. And ended up being a really great program for not only the patients, but also for many organizations, healthcare organizations, as they were able to access drugs at a discounted price. In order to be eligible for the 340B program, there's certainly some requirements that come with it. And there's 6 categories of hospitals that are in the first bullet point that are eligible. And then within these hospitals, there's some specific provisions within bullet point 2 and 3 that, again, I won't go through and read to you. I think one of the main points I'd like to make is to be eligible within these categories, there's generally requirements as far as disproportionate share, your disproportionate share. And it's really important to monitor those on an annual basis because they tend to be hard lines in the sand. To the extent you fall outside these percentages, you then no longer are eligible for the 340B program. So between you and your reimbursement groups, it's really important to kind of monitor this and also monitor what's happening to be able to identify if there's a risk that you may be falling outside some of these percentages. Eligible drugs that are covered need to be FDA approved, over the counter with prescription biological products that only can be dispensed by a prescription. I think one point I'll make here is the covered entity. This is kind of a compliance item, but it's important for the entity to maintain purchasing and separate purchasing and dispensing records for contract pharmacy and in-house pharmacy. In addition to those, a couple other requirements here around eligible patients. There must be an established relationship so that the covered entity maintains records of the individual's care. The patient must receive care from a professional employed by the covered entity or under contract such that the responsibility for care remains with the covered entity. And also the patient must receive health services that are consistent with the services of the grant. So some kind of specific things that need to be in place in order to maintain your eligibility. I think this is somewhat just a little more detail of what I mentioned. Again, there must be a close relation. Eligible providers must have a close relationship with covered entity, and there's various rules and regulations to look at as to if you meet those requirements. HRSA is the government organization that really oversees 340B audits, and it is important that you have appropriate policies and procedures. And it's important to have those up to date. Those are things, if they do perform an audit, they will be looking at those and make sure that those are current. You also need to have a specific policy around material breach. And one of the points we've seen is that there needs to be a definition or threshold of what a material breach may be. And oftentimes you see it defined as a percentage of 340B purchases. Audit documentation. The HRSA requires covered entities to conduct audits of compliance at 340B. That's very important. And you need to make sure you retain documentation of those. Those are things that they will certainly look at if they do perform an audit of your organization. And I think this is just similar. The regulation added the concept of contract pharmacies to 340B program, and it requires the covered entity to have audits conducted by an outside party. So I know in talking to my clients, they've all kind of followed this, but if you're not aware of that, you may want to check to make sure you're doing what you need to in that area. And again, finally, just kind of a reiteration, HRSA is actively conducting audits, and not only of large entities, but smaller entities too. So we've seen all of those. They're very serious about compliance. So it's important. It's a significant benefit to many organizations. So it's important for you to keep that in mind. Tax compliance, really only a couple comments on tax compliance. We had a session on that a few weeks back as well. Point one, don't forget about tax. There still is heavy regulatory scrutiny, and it's also important to think about all areas of the tax. Oftentimes you think when healthcare organizations think about tax, they're thinking about the 990 and whether they've got their community health needs assessment in place, which are very important. There is a variety of other things that need to make sure you're following: private inurement, private benefit inurement, making sure you have support for compensation provided to particularly providers, physicians, that there's support for the fair value of those. There's restrictions around lobbying and the level of lobbying and political activities. There's been some new rules around UBI in particular, where they no longer allow you to offset losses or income from one unrelated business income with losses from another. So keep an eye on that, particularly if you have some unrelated business income, businesses you're involved in that are profitable, and you maybe use losses from others to offset those losses. There's an opportunity to do some restructuring also to avoid potential areas, risks there as well. Loss of tax exemption still continues to be a focus point across the industry. Community health needs assessment is very important. There's a requirement that this must be done every 3 years and subject to a $50,000 penalty. That's been out there for some time as well. And the IRS has been actively reviewing compliance with these rules. So if you haven't been audited recently, I think there is a risk that could happen. It's important for you to make sure that the plan policies are up to date and that they're publicly available, and that there's education around these as well. Other areas we've seen, so kind of a listing of other areas here. I do want to point out a couple things here. Cost allocations among for-profit, not-for-profit affiliates. Oftentimes there's those haven't been updated recently, even though the organization has changed pretty dramatically. And particularly if you're allocating costs to a for-profit subsidiary, make sure that those have been looked at and they're supported. Also, as states and local governments have become more aggressive, and certainly many of these are going to be struggling from a budgetary perspective, they've taken a harder look at different things such as cross-border sales and activities, and are being more aggressive around state and local tax issues, so including property tax, unclaimed property, etc. So again, if you've got you're an entity that kind of crosses state borders, make sure you're looking at how you're handling those type of particular issues. Okay, we've got just a few more minutes here, and I've got about a half dozen slides, but I really only have a couple more minutes. Once again, these reimbursement and related issues we did talk about as part of our series, so I don't want to spend a lot of time. I think those of you that are involved in kind of managing operations or overseeing risk or financial operations, just a couple of reminders for you. I mentioned earlier, some of the COVID-19 matters are really more significant compliance matters as far as monitoring and supporting to the extent you're going to recognize revenue under some of these. So very important to make sure your teams are monitoring those appropriately. And again, on September 29th, I think we've got another webinar on some of those. Cost report implications of these, there had been some discussions around the issue of double dipping, particularly for those of you that may own or control critical access hospitals. Those rules are still evolving, although at this point what we're hearing is that some of these benefits will not be a cost offset, but stay close to your advisors, your attorneys, your accountants on that matter, to continue to monitor the more recent activities there. There still is opportunity to enhance Medicare reimbursement for those of you that are in the health system PPS space. The items down below are some of the key areas to keep an eye on. And some of these, we've talked about 340B, uncompensated care support. You can read that. Bad debts is still an opportunity as well to make sure you're tracking and monitoring and identifying all bad debts for reimbursement. We've seen more audits there around the bad debt information. wage index. For those of you that aren't familiar, it is an opportunity to potentially increase reimbursement under PPS based upon the wage index in your what's called CBSA, core-based statistical area. That does require somewhat of not only yourself making sure you're tracking all the wages in a detail level, but also making sure that you're working with others in your geographical area to maximize or increase your average hourly wage to the extent it's supported, obviously. Within that, here are some areas that we see as areas to take a harder look at in order to maximize, again, your hourly wage rate for your particular facility. I won't go into this in detail, data analytics and AI. Certainly, I talked about this earlier. One quote is from a CEO in healthcare: we have to do this. It's a question of how much we can afford and how quickly we can implement it. There's a ton of opportunity around care delivery in this area. Frankly, I also think the focus initially is going to be around how to better manage and monitor things such as your revenue side, administrative support, fraud prevention, and close processes. Many of you are probably in the financial area, accounting area on this call. And I think there is a real opportunity to take a look at certain areas of your close process and build in some data analytics to assist in that process on a monthly basis. Maybe at certain times of the year, you're going to dive a little bit deeper, but there's certainly some things that can be done in that area. And we'll certainly have more on this whole data analytics area in the future as well. So just some real quick thoughts there. Our advice is, while there's a lot of areas of data analytics and your objective is to get to prescriptive, being able to predict the future, if you will, start slow and create some areas that you really think can add value and reduce time on your end from a data analytics perspective. Well, I went through a couple of these pretty quickly. Stay tuned. We're going to have some more webinars down the road and deeper dives on things. And feel free to reach out to me directly. I'd be happy to answer anything or have discussions on any of this more directly. Like I said, some of these data analytics we had a webinar on this not too long ago, and we're going to continue to do a little bit more in that area as well. So thanks for joining today. Amy, anything else?
No, that's it. Thank you all so much for attending, and thank you to Scott for presenting, and we hope you guys have a great day.